So we just went through the shoulder stretches, and now we're going to talk about the shoulder joint mobilizations. So remember, the convex surface is the humeral head and the concave surface is the glenoid fossa. So for the first one I'm going to do is the glenohumeral distraction. So that would be just a lateral glide. So I like to have the patient's arm completely relaxed. I'm going to have just right against my body, that way I can use my elbow to hold it in that position. My right arm is going to stabilize the humeral shaft. Go ahead and scoot towards me. Good. My left hand is going to grab basically right inside the armpit, and I'm just pulling the humeral head laterally. So this would be a lateral glide because I'm moving medial to lateral. Next we have the glenohumeral long axis distraction. So just like with the hip, I'm just going to gently use my body weight to pull the humeral head slightly lateral. One of the contraindications would be any potential previous risk of glenohumeral subluxations or dislocations. I'm actually going to have you lay on your belly. So next we have the anterior glide. So remember, if we're moving from posterior to anterior, that's going to be an anterior glide. The patient's arm is going to be completely relaxed, and I'm going to provide a downward force using my hypothenar eminence. That's going to be right below my pinky here. Go ahead and relax. Good. And I'm just going to use a straight arm and push directly anterior to posterior. Excuse me, posterior to anterior. You could even have them scoot a little bit more off the table just so that the humeral head isn't blocked by the table. And then again, just pushing down. This would be used if you wanted to increase shoulder extension and external rotation. For the posterior glide, he's going to lay on his back. Good. Again, same position, so I'm just going to hold his arm using my elbow to stabilize his hand against my body. He's going to scoot slightly off the table. Again, using my hypothenar eminence, I'm just going to push using a straight arm from an anterior to posterior position. This would increase shoulder flexion and internal rotation. Next we have the inferior glide. So I'm going to stand at the top of the patient. He's going to, again, just bring your shoulders slightly up. Good. I am going to stand at the top of the patient here, having it about a 90-90 position. I'm going to take my right hand and I'm going to basically just put my elbow into my hip. That way I can use my hip to mobilize him rather than trying to muscle it through. So my left arm is just going to hold his arm up in this position. My right hand is just going to grab the humeral head, and then again I'm just shifting my body weight to push the humeral head inferior. Again, the convex surface is the humeral head and the glenoid fossa is the concave surface. So when we are doing the joint mobilizations, we are increasing shoulder abduction and internal rotation.